Hey there, my name is Anita Lauren. I'm a certified PCOS nutritionist, and this channel is all about healing PCOS naturally without meds and losing weight naturally. And in today's video, we're going to be covering what PCOS, polycystic ovarian syndrome, is, and if you have it or you think you might have it, here's a couple of the signs to look out for. Number one is hormonal imbalances. Most women with PCOS, especially a lot of my clients, come in with insulin resistance, which is high insulin in their bloodstream due to high blood sugar. Number two is high cortisol, aka the stress hormone, being imbalanced in their body. And three is too much inflammation. So typically a lot of these ladies kind of have a combo of three, but you can also have just one versus the other. Women with PCOS often have higher levels of androgens like testosterone, which cause irregular cycles, acne, bloating, other hormonal imbalances, hair loss, and high androgens in their blood work. It can also cause hirsutism or hair growth on other unwanted parts of their body. Because of these hormonal imbalances, it can also lead to ovulation issues, so the egg might not drop from the ovary at the right time per se during the month, and this can also cause missed or irregular menstrual cycles. Some women also develop small fluid-filled sacs in the ovaries called cysts, and that's why it's called polycystic, because sometimes there's multiple of these cysts in the ovaries, but that does not mean you have to have them to have PCOS. You can actually have PCOS and not have any cysts in your ovaries. Insulin resistance. Many women with PCOS have insulin resistance, which is typically just high blood sugar over time, and then the body releases a lot of insulin to kind of compensate for that higher blood sugar, and the ovaries in particular have a lot of insulin receptors on them, and when you send too much insulin to them consistently over time, they start becoming more resistant to that insulin, saying like, hey man, you have way too much insulin coming over here all the time, I'm gonna start shutting the doors. And that's what typically happens with the ovaries and just the body in general. And this is unfortunately why women with PCOS also have a higher risk of getting type 2 diabetes. And here are some of the most common symptoms of PCOS. If you have multiple of these symptoms, you might actually want to go to your doctor to get tested for PCOS, because actually 70% of PCOS cases go undiagnosed with women. So if you are dealing with multiple of these symptoms, you might want to stop by your doctor to see if you can get an official diagnosis, if this is actually what might be causing it. Some of the most common symptoms are irregular periods or no periods, acne or oily skin, excess hair growth on the face, the chest, or the back, weight gain, especially around the belly, hair thinning on the scalp, and trouble getting pregnant. The exact cause of PCOS is still not known, but genetics, lifestyle, and environment all play a role. And as a PCOS nutritionist, I always say that if you're dealing with any of these symptoms, your body is not broken, it's just out of balance. So if you want to learn more about PCOS, you can follow me on Instagram. My Instagram handle is down below. And I also have a free cycle syncing guide, so you can actually sync your exercises and what you eat to the different times of your cycle to actually help lower insulin resistance and high cortisol. And if you want that, just shoot me a DM on Instagram with the word cycle, or you can just shoot me the word cycle to this email down below and I'll send it over. Anyways, looking forward to your healing journey, and make sure to subscribe to this channel for all things related to PCOS healing.